Okay. Welcome everybody. This is the ICAPP contractor meeting. I'm Abby Patterson with Prevent Child Abuse Iowa. Welcome everybody and thanks for being here. I've got the agenda here. I will go ahead and share with everyone. Should have gone out in the email as well, but hopefully everybody's able to see it. Yes. Today we're just going to do kind of a review of some of the billing and reporting requirements for ICAPP. We're going to talk through a few of the changes this year. I know there's been some webinars to go through them, but I wanted to do a review for anybody who's not aware, talk through some of the troubleshooting, kind of common troubleshooting things with billing and reporting. And then we wanted to provide a quick update on the needs assessment. PCA Iowa will be doing a needs assessment for child maltreatment prevention, looking at some data and some different indicators across the state as we move forward. And we'll have some time for questions and answers as well. But I think we can go ahead and get started. Kylie, I'm going to let you introduce yourself as well. Kylie, my partner in crime at PCA.
Hi, everyone. I'm Kylie Spees, the Outcomes and Advocacy Manager, PCA Iowa. You've probably heard from me if you are your billing person or if you need technical assistance with the report or seeing any records. But as Abby said, we are partners in crime on this contract.
Wonderful. And then I know we have at least one new person with kind of the program administration for ICAPP. And I believe, Cass, you are with us, and I wanted to give you an opportunity to introduce yourself. It's probably the first time that many people will be meeting you, so.
Hi, I apologize. I just took a bite, so it took me a minute to come on.
My time is great.
My name is Cass Murrah, and my title is Child Abuse Prevention Program Manager for Iowa Department of Health and Human Services. And I've been with the department for a little over a year. I came from the nonprofit world. I've spent the last 20 years in child welfare in different capacities. And so I have moved on to the happier, greener side of life in prevention. And so I am excited to work with all of you. I have met Abby and Kylie, and they're both fantastic. And so I have no doubt that everyone else is on the same wavelength. So I look forward to working with all of you and learning the intricacies of all of these contracts, because it's been a little overwhelming, but I'm learning. And I apologize for I had a dress on, but it's cold in my office, and so I had to throw on a hoodie last minute. So this is not my typical attire, but I'm going with it today.
That's all right. I'm glad everybody can be comfortable. That's one of the bright spots of Zoom. We are glad to have you with us, Cass. And for many of you, if you remember Leslie Dooley or Lisa Bender, Cass will be filling a similar role at the department. So I anticipate we'll be working closely with her on the program, but wanted to give her a chance to say hello. All right, so got the agenda. I think the first thing I wanted to cover was updates to the GACSs and monthly expense reports. We do individualize these so that they're kind of correct according to the contract, what we have for billing addresses for folks and vendor numbers and all of that good stuff. So I am in the process of getting all of those revised for FY24. The MERs are all done. The GACSs, I think I've got about 5 left. So those should be done by the end of the day, and you will get them emailed out by the end of the week. We do kind of lock down those forms just to make sure if there is a change, we want to make sure it goes through all of the correct protocols in order for, like if you have a change in where your payments need to be mailed to, and you need to make an address change, there's some things we need to do on the back end to make sure that goes through appropriately. And so we don't want to miss those. And so we do lock down a lot of those forms. Same thing with the budget. There's a budget request if you need to make an amendment to your budget. So if that's the case, let me know. We'll get you what you need, and then we'll revise those forms for you so that you have those. I do also want to say, if you have a budget, if you'd like to amend your budget, always like to remind people, those have to be done the month that they need to be effective. So if it's September and you decide you needed to revise your budget for July, your overall program budget, we can't go back and apply those retroactively. They can only be from like September onward if we get a budget revision. So if you notice you need to make a change in your budget, let us know right away and we'll get you the form and get that process underway. You do have 10% flexibility among line items with your budget. So if you're just shifting a little tiny bit of your budget and it's under 10% of the value of your total contract, you'll use the MER that you have. You will not need a new one if you're just shifting it slightly within that 10%. Budget amendments only need to be kind of officialized if they exceed that 10%. And then with any budget revision, we still have to stay within the 15% allowable admin and the 5% allowable for incentives. So that hasn't changed. The process hasn't changed, just kind of a standing reminder. So new forms should go out by the end of the week at the latest. If you don't get yours, please let me know right away, or if the right person doesn't get it. I know we have from time to time new people handling different processes. So let us know if there's contact changes there as well. We want to make sure you get what you need in plenty of time to submit July billing. Questions on anything related to GACSs and MERs? I know Kylie's going to do a review of, I'm going to stop sharing and let you do a review of the billing submission process.
All right, just give me 1 second. I'll make sure I have this up and correct for you. I have so many windows open. I honestly don't even remember what's what anymore. Okay, so if you have been doing the billing for your contract, you are not going to see any significant changes with that this year. You should have the link, which is not changing. And if you don't, we have or will send you out a new document. Abby, have you sent out that half sheet with all the links on it?
I haven't sent it yet, but I will following this meeting.
Okay, and even prior to that, I will drop a link in the chat for you so that you have access to our shared folder where all of that lives anyway. So you won't have to wait for it. But if you just need a reminder, you just want to be able to pull it down, save it to your hard drive, and then all these links are in front of you all the time, you can do that. So you have there's a link to a OneDrive, like a Dropbox that we use to collect invoices each month. We don't accept them by email anymore. So to submit your GACS and MER on a monthly basis, you're going to visit that link, and then you are going to just click where it says add more files. You're going to pick a file and you're going to click upload. And then you can do another one. So if you have multiple contracts that you bill for, you have multiple invoices that you manage, you can just do one after another. You also can always take a screenshot of this if you're nervous about it, but I'll show you in a minute where you can see a record that we did receive and process your billing. Switch gears here. I'm going to switch and I'm going to show you that portal now, and we'll open up the document where all these links that you'll need are housed. So you have access to this folder. This is on our SharePoint site. This is the link that I'll give you here shortly. And this is just a repository of different resources that you might need throughout your contract year. So the first one I'm going to pull up right now is this ICAPP quick guide. We sent you one of these last year. We've updated it for this year, and it looks a little different. So you can remember that this is the new one. That link to submit invoices is here. So if you click on that, it's going to take you to that Dropbox I just showed you. It also gives you the procedures It is so helpful to us if you can just do a few small things when you submit that billing. So we ask that you name it as the contract number, the month, and the year. It's 2 digits. So like 21-099-7.23. In addition to the many other hats I wear, I process about 65 invoices for HHS each month. So if we have even a few where I can't tell who it's from, or I have to go back and forth in the system to see, you know, this file name is actually from this, really slows down the process and makes it harder to get good, accurate documentation and timely submission. So we also ask for those to be uploaded as a single PDF document. The GAC's on page 1 and them are on page 2. Last year, remember, there was a new requirement that any lodging that is booked in the state of Iowa needs to be searched in the human trafficking certification database. So if you book a hotel in the month that you're submitting the invoice for, go to that website, stophtiowa.org. I think there's a link to that. You're going to find the hotel, take a screenshot. You need to do that before you go to make sure that it's eligible. Almost every chain is, almost all hotels are, but you just, in any case, you need to verify that the hotel you're staying at is certified in human trafficking prevention. Take a screenshot of that and then stick that into your invoice in page 3. So most of the time, if you're not booking lodging in the state of Iowa, you're going to have a 2-page single PDF that you're uploading with these naming conventions in place. So nothing significantly new in that area this year. But does anyone have any questions about any of that, or if you've had issues with anything that you that you've run into in the past year of this new system? That reminds me, I should stop sharing too soon. I do want to show you one more thing that we have in that system, in that link that I will share with you. And that is, sorry, I'm 100 years old right now. Here we go. I apologize. In that folder where you have those quick links, those links are also pinned at the top. So if you need to upload, you can click there. If you need to submit your quarterly report, that's right there as well. There's also a file called ICAPP billing records. There was one for last year. There's a new one for this year. So when you open this file, there's evaluation links are on one tab. You'll need to click enable content in this yellow bar at the top. Otherwise, it will not update for you. You won't be able to see the latest data in this. For some people, your IT department does not allow this, and that's not a thing that we can resolve for you. But we're always happy to provide you a screenshot of this. So if you go into billing records, you're going to see all of the ICAPP contracts and all of the months of the year. When we process your invoice, and by process, I mean we receive it, it's correct, we double check that everything is in place, and we send it on to HHS, you're going to see the date that we did that and the date received. There won't be a date received in there until it's been processed. And then it's going to calculate a 60-day turnaround for you. So if you, let's say you submitted a July invoice, you submit it in August 15th, we process it August 23rd, and it's September 15th and you haven't been paid yet, you're going to know when you look at this, that's a reminder that that's not really due until October 15th. So it helps you kind of manage expectations and know what we received. So you can always pull this up or ask us for a screenshot if it doesn't work for you. And you'll be able to see what we've received and when it's been processed. And there are other things in this folder in addition to those billing documents. There's PDFs, or sorry, Word documents of the report, the quarterly report that we'll talk about. There are evaluation links. There are other links like to the alignment, to the hotel human trafficking lookup. There are a variety of resources in this folder that may be of use to you. But if you are having trouble finding any of the links that you need, they're always going to be in here. One thing to know is that you can't just access it and then bookmark it, because it's kind of like a special encrypted URL that it won't save it when you go to bookmark it. So there are instructions in here called how to bookmark this shared folder, because if you want to be able to return to it through your browser, you'll need to edit your bookmark to that correct link. So there's a document in here that can help you do that, or you can just always return it to it in your email, whichever way is fine. But that's kind of our central storage place for all of the resources and links that you're going to need this year. All right. Anything I missed, Debbie?
I'm not seeing anything, and I'm not seeing anything in the chat box. And we'll have time at the end for questions too if something comes up. I'm going to move on then to the ICAPP contracts. ICAPP contracts for the vast majority of folks have been signed by all parties and have been returned. If you have not gotten your signed contract yet, it's very likely due to it being signed late or returned to me or after the deadline. It's probably been signed, but let me know. I've got a couple that have been signed that were signed a little bit late that I haven't gotten out yet. Again, those will go out by the end of the week, everything that I have. The biggest changes in the contracts this year haven't been substantial changes to scope of work. For folks that are doing family support programming and use DAISY, there are some changes for DAISY that we will go over. But for the vast majority of you, contracts were extended, and there may be a new budget or a slightly different scope of work. But most folks had either a renewal letter where nothing changed, or you got a renewal letter and then you had an amendment going over any of the changes that we will talk about. Before we get to the DAISY changes, I did want to go through the quarterly reporting. This has not changed. Let me pull this up just a moment. And I will share. So the ICAPP quarterly narrative reporting has not substantially changed for FY24. I'm going to go ahead and put in some basic information here. You'll still put your identifying information on the first page. You'll select which quarter you're reporting for, which service type, and then you'll go to the reporting questions. I do want to point out that last year, I believe, for home visiting and parent development, the group sessions said this quarter, we want to always get that information for year-to-date total. So it will say this fiscal year. Please ensure you're doing it for the fiscal year on the quarterly report. Some of these questions are not required. The number of group sessions is required on here. You'll click through. We know sometimes one person does the report for the entire project, and then sometimes we've got folks from the program that are doing the report for number of group sessions, and then somebody else, like from the council, will do reporting on community development or what's those council activities. That will stay the same. You can have more than one person doing the reporting. And so you'll put in your community development measures. So maybe you're doing info sessions, and then you have 2 of those per year, or maybe you do a family fair and you have 1 of those per year. That will stay the same. If you have more than one person putting in duplicate information, please go to the narrative box, add any additional information about community development, and you can put in there like this is an update because we forgot about one the first time we submitted the report. There's still the section on your narrative. So progress that you made, if there's in general things that happened, maybe your community had a natural disaster, maybe your community is having difficulty with recruiting, whatever those things are. Question number 20 asks about adherence to model. So maybe you are working on training, maybe you're working on getting the number of visits or the number of group sessions as outlined in the model. Maybe that's something you're struggling with. Whatever that is, if there's any deviations from model fidelity or adaptations or things you're working towards, you'd put it in that section. Still a section for share a story of impact. You know, we want to be able to tell the story of the value of our programs, and the value of our programs isn't just the number of people we support or the number of sessions we provide, but really being able to demonstrate, like, how is this impactful for families? And those stories are very important. So we want to hear those ways that families are able to grow, ways that families are able to get connected with services and supports and resources to be as strong as they possibly can. So please provide a story for that whenever you are able. The next tab goes through council activities at the council's meeting. As a reminder, is one of the contract deliverables for the council to be in existence and meet regularly. That harkens back to how the program is worded in our state law and the language of the rules around that requiring a volunteer coalition or council to be able to get these funds. So that's the way that we are tracking whether or not we're meeting that expectation that that these funds are supported by a community coalition or council. And then the last section, I know sometimes when folks are reporting on service numbers, we don't have all of that financial information back yet. That is perfectly fine. If you have to come back and do this later, that is okay. The first page requirements where you're entering your name and your email and your contract number, you'll still need to put that in because those are required questions. You'll still also need to put in the number of group sessions that your project provided. You can skip everything else and then just come right to this last page to put in that financial information if you have to come back in and complete that part later. There we go. And then once you hit submit, it will take you to this screen. And this is the question I've had several times in the last even just couple weeks, where people are needing to get their information because they weren't sure what we had last quarter, or they think they made a mistake or somebody made a mistake when they were submitting information. So if you click print or get a PDF of your answers, it'll bring up this screen. And for me, it brings up, you might get a printing screen. So you see up here where it says printer, this is my default printer at the office. You can also select Adobe PDF. And so it'll bring up a print PDF screen. So you'll be able to save. I'll hit print and then I'll be able to save that quarterly report example, save. And now I have that saved. It's saving in my documents. You know, I know some folks, it was just bringing up a print screen and they wanted to save it and they were not aware that they would be able to do that way. Questions on that?
One thing that I would point out too is that even if you don't have Adobe installed on your computer, that Microsoft Print to PDF should be an option for everyone. So you don't have to have that software in order to be able to do that.
Okay. And then I know we have a couple of folks that have a program improvement plan, and one of the requirements for programs that have been struggling a little bit is just for us to be able to keep track more frequently what's going on with the program. Are there still struggles? Are you making inroads with recruitment or admitting new families? And so there's a monthly reporting form. So I'm going to bring that up. It's a link and a form very, very similar to the quarterly report form. So you'll still have your entering your contract number, your, let's see, Polk County. I'm still Abby. I still have the same email address. And this is for the report, let's say for July. Now you'll notice there's not a selection here for September, December, March, or June. And that's because you'll be submitting your quarterly report. We're not asking folks to do this form during the same month where you're already submitting a quarterly report. So this is just those in between months. And then whatever your program type is. And then it's kind of a shorter list of questions. We're just asking like, how many new families were enrolled? How many group sessions did you complete? How many in-home sessions did you complete? And then there's a little box for kind of a brief narrative. What's been going on? Is there any TA you need with recruitment, or what's going on with, if you're experiencing a staffing challenge and that's impacting your ability to provide services. Again, this is intended to be a brief update, just kind of checking in a little bit more regularly if it's a program that's having some challenges. And then you'll click next. And then if there's any an update for your council, you can enter that in as well. You'll hit submit. So that one's a lot shorter. And then again, you can print your answers or get a PDF of your answers. So that is just for programs that have a program improvement plan. And if you have any questions about that, as the monthly, just definitely let me know. Has the monthly update form been sent out to those programs yet? It will be sent out by the end of the week. I know some folks have asked me if they could see it. I did just make an update to it today, but the link will stay the same if you already have it. The intention of that form is not to burden folks with lots of extra paperwork, but really just provide a brief snapshot as to what's going on. Questions on saving your quarterly reports, completing it. Again, these have not it hasn't substantially changed as far as the quarterly reporting report from last year. And I am going to click out of there. And let's see if we have any other questions. I'm not seeing or hearing anything. So I will move on to the daisy changes. I know the folks from KU, now I have a question. Okay, just to clarify, is it okay to have different council members submit different portions of the report? Yes, it's totally okay. One thing I will encourage you, if you have somebody reporting things that are related to like service delivery, the core service delivery, and somebody reporting information for the council, that is totally fine. When we get this, we get it in like an Excel spreadsheet, and then we can manually combine those. It's 2 lines of data into 1 line of data. It does help if only one person submits for each question. And so coordinating who's answering which questions is helpful. If folks want to have just one person get that information and submit it in one report, that's okay too. But yes, it's okay for us to have multiple submissions. It just helps us that if there's not duplicate questions answered, especially if there are different answers. Jennifer, when will the monthly update start being due? So those will be due for July, August 15th. Unless August 15th is a holiday or weekend, then it'll be the next business day. Good question. Okay. All right. So I'm going to give it one more minute for questions. Okay. I'm on my Daisy sandbox, you can see here. And I'm going to go ahead and add a family. So let's say I have, and I've already started to put some data in here for my family with Kylie Spees as the caregiver. In my PAT program, we've got Kylie. I've entered her information. One thing I wanted to highlight for folks that are using Daisy, DHS funded programs, that is, ICAPP is considered a DHS funded program. These funds come through HHS, and so this is a required question for everybody to answer yes or no for any ICAPP funded programs if the caregiver has a disability. We do, I know sometimes folks don't always know, but we are encouraging everybody on your enrollment paperwork to ask the question. And there's a definition. Disability includes any physical, cognitive, or health-related condition or impairment that substantially limits one or more major life activities. So that can go on your enrollment forms with the definition. And we don't require that you are asking people what their impairment is or to have their diagnosis, like validated with paperwork. This is something that the caregiver can answer, and that they can, if you read that to them or have that in print for them to identify whether or not that applies to them. But I do want to highlight the disability question is required to have a yes or no for all ICAPP participants. And so there's all of the other enrollment questions here. These should all be information that everybody is familiar with. None of this information here is, or none of the questions here are new, but you're enrolling a participant. I'm only showing you this because in order to get to the next screen, I have to create a caregiver. Why is the data not saved? Now it's going to make me go back through. Sorry, I think I timed out. That's what I get for trying to be prepared. Okay, we'll start over here. We're going to add a caregiver. Thanks for bearing with me, everybody. Entering in here all of my good data. Okay. Now I can save. Okay, wonderful. So now I'm going to go to family activities. I want to remind everybody, and I know Daisy has put out some webinars on this. I believe that ECI has provided some training around this, and I know we talked about it when we discussed contract renewals for the year, but I want to make sure everybody is aware. repetition is sometimes a good thing. It used to be that we would do a quarterly report at the end of every quarter for every family, and that's how we would tally all of our quarterly home visits for the year. We would pull that information out of Daisy. We are no longer doing that, and so we are now using the home visit review form. And so the home visit review form needs to be completed for every in-home visit with a family. So let's say I had a visit with Kylie on Monday. I'm going to pull her up here, see if there was anybody else with her at the visit. I was the family support professional. It was in the family home. It was a 60-minute visit. And I'm going to say we discussed gross motor development and food resources. And then there's, I don't have a child with this family yet, but there's going to be follow-up questions if they visited the ER, child SPEEs. And then, are they following safe sleep recommendations? How many additional children? No additional children. And then again, if you save, it'll save it as in progress, but it will not submit it. You want to make sure you're submitting. So those home visit forms need to be completed after every visit. And I believe it's within 48 hours, but I can double check the Daisy data dictionary and information there. That's probably the biggest change this year. And I see I have a question, Kim.
You said home visit review form. Your farm is not like mine. I don't have that on mine.
You don't have the child stuff?
No, I mean, I have the FSSD home. I don't have your home visit review.
You don't have home visit
Review.
What is
you just put up?
What do you have?
I just have when I do the home visit review, and it's just home visit information. That's all it is. Boom. Activity, who was involved, me, where was it, and length of visit. That's all I got.
Okay, so you don't have the questions
Why?
on the bottom with the children?
Yeah, no.
Okay. Mine is go ahead.
Has it, I mean, am I supposed to have it? Are we all supposed to have that? 'Cause I
Probably
don't have it.
not. Mine does not always match up exactly with what programs have. What you have is probably correct. Because mine, I'm in like the training area, and it may be closer to what McVie has. I'm not 100% because I don't see what folks at programs see. I just am able to go into the training space. So if I'm showing you questions that aren't on yours, don't panic. I'm sure yours is correct.
Thank you.
Good question. I am seeing lots of questions in the chat. I think you have the McVie version. Well, and I know I have both McVie and FSSD training, but FSSD home visit review form. Oh, look at that. It's on there. How about that? Yep, that's what you should see. Sorry to make people panic. But yeah. This is the one folks will need to complete. Sorry about that. And then so that because we're doing these to track the number of home visits, we don't need to do that quarterly report anymore. The one that is like these FSSD quarterly report caregiver or FSSD quarterly report child will not be required anymore. Questions on that? Okay. The other thing that I think, when does that take effect? That is taking effect as of July 1st. What about, good question, what about groups on Daisy? Home visit review form, I don't believe that there's a place on this form to track groups. I don't know if they are planning to change something for how groups will be collected. But because we collect that information on our narrative reports, we will not require anything else to be done other than putting the number of groups in your narrative report. Resilient communities, good question, Cassie. We'll get through this in a couple of minutes, and then we do have some stuff that'll be relevant for everybody. Kim, will the quarterly report look the same when going to report? I'm not 100% sure. Can you clarify that question?
When you go to the data to go to the reports, when you pull the reports first, will it still look the same when you're trying to pull up a full quarter report? To look at the data.
That Jordan said that report is being updated. Yes. And I will show you at least what I have on my side in just a minute. I do also want to pull up the Iowa retrospective PFS2. So for groups or anybody doing short-term home visiting, we have officially, as of July 1st, moved to the PFS2 instead of the original PFS. A lot of this information, like the date of the activity, when it started, how was the survey completed, is going to be similar. And then sorry, let me get through all my dummy data here. And then you will have your PFS2 survey. We do have training for that. We've got a couple scheduled. We can chat more about that at the end. But yes, we have officially moved from the PFS to the PFS2 retrospective. One additional thing I want to make sure that we cover is the environment data. I'm going to move away from this for just a second, and I'm going to go to environment data and then add environment. And so this is also a new feature within DAISY that all FSSD programs need to complete for every program. So because multi-county programs were kind of split from being one big program to being like PAT Polk County and PAT Story County. Another feature in here is to identify the environment. So like including staff information for every program. So like what's our funding, what's your position, what model is it, and then what's the FTEs for all of those positions within that program. So like if I am a 0.5 FTE for this program, my environment name is going to be Abby Patterson. I'm going to have my email in there. I'm going to pretend like I'm younger than I am. I'm going to put in all of my information, the languages that I speak, you know, enter in that information, your hire date, and then your both when you were hired by the organization and then when you started the position that you're in. So if you were hired as a family support professional and now you have a caseload, but you're also a supervisor, you'd go with whatever hire date for the position is the most recent and entering that information. Okay. Questions on the environment record? I will show folks, I gotta get out of training and into the regular FSSD. So what we used to see was this quarterly mid-annual report tab. And it looked like this. And I think what folks are asking about is, I'm going to click out of there. The service and demographics and the performance report are two new reporting features that are coming into DAISY. That is going to look a little bit different to report kids and families, family and child counts, what are your caregiver demographics. A lot of the same information, but it looks a little bit different. Good questions. Will the quarterly report look the same when going to reports? And not sure if I did it right. Can you delete and try over? Is this with the narrative report that we send? Or that you like that goes through our, like the ICAPP specific link?
No, I'm not sure if I did the environmental data right. I'm wondering if I could just delete myself out and start over. Because it asks for, you know, it's like 3 different things, because I have to do ECI, ICAPP as home visitors as well as a supervisor.
Yeah, it's like basically every position, every part of your FTE in every county that it covers should be individualized.
Can I delete it and start over?
I'm not sure about the deleting, but I know you can do it over. And I will find the answer out to that and send it out. See if I can send out some guidance around that. Okay. That was a lot of DAISY information. And if we want to come back to those, or if you have a question that comes up related to DAISY, I will stay on after this and we can troubleshoot if there's any of those individual questions. But I do want to get to the needs assessment here before we run out of time and just provide kind of a quick update on that. Like I said, we are going to be doing a needs assessment for child maltreatment prevention. We've got a lot of data that we're looking at, both with like risk factor indicator data, as well as just looking at the landscape of programs across the state. How do they all work together? You know, we've got Early Childhood Iowa, we've got FADS, we've got McV, we've got HOPES, we've got ICAPP, we've got sexual violence prevention funding, and looking at how all of those funding streams work together to meet the needs of communities and meet the needs of kids and families. So we are kind of right in the middle of pulling all of our data together. We've contracted with Public Consulting Group, who does our evaluation for our programs, to help us with some of the analysis for that project. One of the big things that we will be doing is to do a provider survey. We want to hear from folks working in the fields and working in communities to identify kind of what are those gaps, what are the needs, and understanding that that might look a little bit different across the state, but folks being able to articulate kind of in a perfect world, what could we do to make parenting easier for kids and families. We also have a survey that's going out, not just for like community members, but specifically for parents and caregivers that have kids, and wanting to hear from them, you know, what do you need? What would be what's not in your community that should be, or what's in your community, but there's a wait list so that it's not easily accessible. So all of those things, we're going to be pulling together that needs assessment. We're working on it now. We're working on it this fall. I anticipate we'll talk a little bit more about it at fall regional meetings, and we'll be trying to get some feedback and information from ICAPP network members at that time, and also ongoing. Want to see if there's any questions about that, if anybody wants to get more information about it. Aside from that, want to keep folks in the loop and being transparent that that's happening.
Abby, is this separate or different from what HHS is doing with their, whatever they're calling it? I don't even remember.
With everything that's going on with the alignment, that's a good question. This is a separate effort, and it's really targeted at child maltreatment prevention. So I do want to stress for folks that as many like community members and like stakeholders as you have that can provide feedback on the survey, and as many families as you can get the survey in front of, the better it is. The more data we have, the better we can assess what the needs are and understand what people think and what people say they need. But yeah, this is different. I think it's also, it's good and bad timing wise, because we know there's a lot of change. There's been change happening. And also, you know, if there are changes that have been implemented, and this is a good way to talk about them. It's not necessarily meant to inform anything as far as like alignment, like at the alignment level, because that's kind of a big picture thing that's happening. But it also helps us take a look at, you know, with the alignment, does this change how we want to prioritize need, or how we look at need for kids and families, things like that. So I think it's timing wise is a good opportunity, knowing that this other effort is going on. As far as the alignment, I think working with other programs and funders within Early Childhood Iowa, you know, we're all in the same division, bureau. I'm not, the name of whatever that is escaping me, but we used to be in very different, in different places. Like we were in DHS, and they were in either Department of Management or Public Health. And now a lot of the programs that we have worked with, and it makes sense for us to partner with, are actually housed in the same structural area within HHS now. So that's good. But I think in terms of how ICAPP is prioritizing funding and need, and really looking at where does ICAPP best fit in for early childhood and other family support services and other community initiatives, the more feedback that we have, the better. Kylie, did I miss anything in terms of kind of data and what that process will look like?
I don't think so. We don't really have hard dates or plans for any of those follow-up things, but we will communicate those when we do have them. Dates are a little flexible right now on all this.
Okay, well, I'm going to stop recording because that is all of the content that I have.